Today we'll discuss about the muscles of the arm. That is, we will talk about the origin, insertion, nerve supply and action of the muscles of the arm. So before we discuss the muscles, let's see a general structural framework of the arm. That is, the arm is divisible into two compartments, an anterior compartment and a posterior compartment. And these two compartments are separated from each other by an extension of the deep fascia, that is medial and lateral intermuscular septa. So you can see here in this figure, this is basically humerus. It's a transverse section taken from the humerus bone, and it is showing the various muscles of the arm, that is the biceps brachii, the brachialis and the triceps. And this layer you can see here, it's the layer of deep fascia covering these muscles, and it is this deep fascia that modifies into intermuscular septa, and it separates this anterior compartment of the arm from the posterior compartment. That is, it separates the biceps and brachialis from the triceps behind. And these intermuscular septa, so you can see here also in this figure that the deep fascia modifies to form the intermuscular septa, and they are attached on the supracondylar ridges of the lower end of the humerus. So this is the lower end of the humerus, and these are the supracondylar ridges, that is the lateral and the medial. The medial intermuscular septum attaches on the medial supracondylar ridge, and the lateral intermuscular septum attaches on the lateral supracondylar ridge. And the function, the utility of these intermuscular septum is that they separate the anterior and posterior compartment of the arm. They separate the muscles of the anterior and posterior compartment of the arm, and through these septa, various nerves, various blood vessels, they also travel piercing these intermuscular septa. They also provide additional surface area for the muscle attachment. For the bulky muscles, they provide extra surface area. You will find them well defined only in the lower half, that is, they are attached to the lower end of the humerus. So these are the nerves that pierce, these are the vessels that pierce the medial and lateral intermuscular septum. That is, on the medial side you will have the ulnar nerve and the superior ulnar collateral artery, because we all know that the medial side of the upper limb is ulnar dominated. It is the ulnar side of the upper limb. So all the ulnar nerves and the ulnar vessels, they will pierce the medial septum. And the lateral side is radial side. It is a radius dominated. So the radial nerve pierces the lateral septum, and also the anterior descending branch of the profunda brachii artery pierces the septum. There, apart from the lateral and medial intermuscular septum, there are other septums as well, that is transverse septum. So the transverse septum separates the biceps and brachialis, that is, it separates the muscles of the same compartment from each other. So brachialis is the deeper layer in the anterior compartment, and biceps is above the brachialis in the anterior compartment. So both these muscles are separated from each other by the transverse septum, and this septum also encloses one of the very important nerve, that is the nerve of the arm, that is musculocutaneous nerve. Similar to the transverse, there is an anterior-posterior septum that separates brachialis from other muscles that are attached on the lateral supracondylar ridge. And this septum also encloses the same radial nerve and anterior descending branch of the profunda brachii artery. So before we start with the actual topic, that is the muscles of arm, it was just a brief view about how the muscles of the arm are separated from each other. So we divide the arm into two compartments, that is anterior compartment, flexor compartment, or the posterior compartment, the extensor compartment. The anterior compartment of the arm consists of Number 1, Coracobrachialis muscle. number 2 biceps brachii muscle, and number 3 brachialis muscle. And the posterior compartment has a single muscle, that is the triceps brachii muscle. If we talk about the anterior compartment, the entire anterior compartment is supplied by the musculocutaneous nerve, that is the root values are C5 and C7. Only the brachialis receives fibers from the radial nerve as well for proprioception properties. The entire posterior compartment is supplied by the branches of the radial nerve. The root values are C7 and C8. And because triceps, so triceps means that this muscle has 3 heads of origin. So each head receives a separate branch of the radial nerve. Now we start with the origin and insertion of the muscles. So first we take the anterior compartment. The first muscle is the Coracobrachialis muscle. So as the name is suggestive, this muscle will take origin from coracoid process and it will get inserted into brachialis. That is, it takes origin from scapula. This is the coracoid process. In the figure you can see here, this is the coracoid process of the scapula, and from the tip of that coracoid process, along with the short head of biceps brachii, the short head of biceps also takes origin from the tip of coracoid process. So it takes origin from this and it gets inserted into the brachium, that is, it gets inserted into the humerus. So the name Coracobrachialis suggests that coraco is for the coracoid process, the origin, and brachialis is for the insertion, that is, it is inserted into the middle 5 cm medial border of the humerus. Humerus is bone of the brachium, only bone of the brachium. So this muscle that you see here from the coracoid process to the medial border of the humerus is the Coracobrachialis muscle. Second is the biceps brachii muscle. The bi means 2. So this muscle has 2 heads of origin. That is, it has a short head and it has a long head. Short head, as told earlier, takes origin from the tip of the coracoid process along with Coracobrachialis. So you can see here the fiber of the Coracobrachialis, and you can see here the short head of the biceps. Both take origin from the common point, that is tip of the coracoid process of the scapula. This is the scapula bone. The long head of biceps takes origin from the supraglenoid tubercle on the above the glenoid cavity of the scapula, and also from the glenoid labrum. So I'll show here that this is scapula, this is the coracoid process, this is the glenoid cavity of the scapula. So there is a tubercle below this glenoid cavity and there is a tubercle above this glenoid cavity. The tubercle above is known as supraglenoid tubercle and the tubercle below is known as the infraglenoid tubercle. So if we talk in the context of biceps, the supraglenoid tubercle gives origin to the long head of the biceps brachii muscle. If we talk about the insertion of the muscle goes and gets inserted on the radius bone of the forearm, that is on the radial tuberosity, the posterior rough part of the radial tuberosity. So that you can see here in this figure. This is radius, this is ulna. So on radius, on the upper end, there is a tuberosity, there is an elevation, and this tuberosity has 2 parts. One is the anterior part, another is the posterior rough part. So the posterior rough part gives insertion to the biceps muscle. And the anterior part and the posterior parts of the tuberosity are separated by a bursa between. The insertion of the biceps tendon is on the radius, but the tendon of the biceps brachii muscle gives off another extension which is known as bicipital aponeurosis. A flat tendon is given off by the muscle and that tendon extends up to the ulna bone, which you can see here in this figure, that the tendon is getting inserted on the radial tuberosity, but there is another extension that is going and extending to the ulna bone. That extension is known as bicipital aponeurosis, and the significance is this aponeurosis separates the median cubital vein and the brachial artery, two very significant vessels of the upper limb. Next, after biceps, we come to the brachialis muscle, the deepest muscle of the compartment, anterior compartment of the arm. This muscle directly, it is related to the anterior medial and anterior lateral surfaces and the anterior border, because see, we are talking about the anterior compartment and we are talking about the anterior compartment of the arm. In the arm, we have a single bone, that is humerus, and because it is the muscle of the anterior compartment, so it covers all the anterior medial, the anterior lateral surfaces and the anterior border, and also the medial and lateral intermuscular septum. So it is a bulky muscle, large, needs excessive surface area, and it gets inserted on the ulna bone, that is the coronoid process and ulnar tuberosity and the rough anterior surface of the coronoid process. So if we see here in this figure, this is ulna. This part of the ulna, this process that you see here is the coronoid process of the ulna, and this would be the rough anterior surface, and this elevation you can see here is the ulnar tuberosity. So biceps gets inserted on the radial tuberosity and brachialis gets inserted on the ulnar tuberosity and the coronoid process. So after this, we have completed the muscles of the anterior compartment of the arm. We come down to the action of these muscles. So if we talk about the action, as I told earlier that the front compartment, anterior compartment, is also known as the flexor compartment. So all the muscles are involved in flexion. That is, Coracobrachialis flexes the arm because it is only limited to the arm. It is only limited to humerus. So it flexes the arm at the shoulder joint. Brachialis, it extends up to the ulna, so it flexes the forearm at the elbow joint because it crosses the elbow joint, so it flexes the forearm. And the biceps muscle, it has multiple actions. It is a strong supinator, especially when the forearm is flexed. It helps in supination, and that movement, it contributes to screwing movements. That is, when we are screwing, our forearm is flexed and we are strongly supinating it, so it makes the screwing movements possible. Apart from that, because it is muscle of the flexor compartment, it flexes the elbow joint, it extends up to radius, so it extends beyond the elbow joint, so it flexes the elbow joint. The short head, it flexes the arm, so it is a arm flexor and it is a forearm flexor as well. And the long head, it prevents the upward displacement of the head of the humerus. So if you give a closer look to this figure here, you will see that the long head of the humerus, basically long head of the biceps, it turns over the head of humerus and it comes down, so it will prevent the upward displacement of this head. So these are the actions. We have already seen the nerve supply. The entire compartment is supplied by the musculocutaneous, and brachialis receives the radial nerve for proprioception. We come to the posterior compartment of the arm. It consists of triceps muscle, radial nerve, profunda brachii artery. The nerves in the artery, they run through this muscle. In this tutorial, in this video today, we'll cover the triceps muscle. Later on, we'll cover the nerve in the artery as well. So tri means three. It has three heads of origin. That is, long head takes origin from the infraglenoid tubercle of the scapula. We have already seen that tubercle, that this is scapula, this is the infraglenoid tubercle. It is for the long head of the triceps. The supraglenoid tubercle is for the long head of the biceps. Apart from the long head, this triceps also has a lateral head and has a medial head. So the lateral and medial heads, they are related with the radial groove that is present on the posterior surface of the humerus, because the radial nerve passes through that groove, so it is named as the radial groove. So you can see here in this figure that this is the radial groove, and the area lateral to this groove gives origin to the lateral head of the triceps, and the area, the large triangular area that is medial to this radial groove, gives origin to the medial head. So you can see here there's an oblique ridge in the upper part which is corresponding to the lateral lip of radial groove, so it is giving origin to the lateral head, and there is a large triangular area on the posterior surface below that radial groove that gives origin to the medial head. And medial head also takes origin because you can see that covers large surface area, so it also occupies the medial and lateral intermuscular septa. This is showing the origin and the insertion as well. It will show of the triceps muscle. So you can see here, this is the long head, this is the lateral head, and the medial head is surrounded by the long and lateral head. So you can't see, but little bit impressions of the medial head. This is the medial head, this is the medial head. Some parts you can see, but it is basically hidden behind the long and the lateral heads. So now how does the triceps gets inserted? The long and lateral head, they will converge and fuse. So you can see here that the long and the lateral head, they are converging together, they are coming together, they are fusing, they form a common superficial flat tendon, and they get inserted on the superior surface of the posterior part of the olecranon process of the ulna. So this you can see here in this figure, that this is the coronoid process which is related to the brachialis muscle, and this is the olecranon process of the ulna. So the posterior part of the superior surface, this part gives insertion. You can see here that this part is giving insertion to the triceps muscle. That is, long lateral head will fuse, they'll form a superficial tendon and it will get inserted into this, and the medial head is partly directly inserted on the same location, that is the olecranon process of the ulna, superior surface posterior part, and partly the fibers will get inserted into the superficial flat tendon. Action, because it is the muscle of the extensor compartment, so it will powerfully, actively extends the forearm, that is at the elbow joint. It also extends beyond the elbow joint, and the long head, it supports the head of humerus in abducted position of the arm. So that is all about the muscles of the arm. That is, we have a look at the anterior and the posterior compartment, the muscles, their origin, insertion, nerve supply and action, and we have had a general view about the intramuscular septum. So thank you so much for watching the video. Please do like, share, comment and subscribe to the channel for more videos filled with the medical knowledge. Thank you so much.